patient experience, growth in profitable services, quality of care, cost reduction, reliable operations, physician engagement and alignment, regulatory compliance. These are all no doubt important priorities. As a leader of an essential hospital, you desire positive trends across all of them. But what truly inspires you? Your mission, helping the most vulnerable and underserved populations in your community achieve healing and wellness. So how do you successfully achieve your mission and priorities within such a complex and challenging environment? Coordinating the progression of patient care and orchestrating that care using a command center ensures that no patient gets left behind. Caring for patients is delicate and complex. So how do you do it efficiently in concert with the mission and in support of critical priorities? Retaining top talent, giving nurses a voice, diversifying services, creating an incident command center, even optimizing your EMR and technology. It's not enough. Your teams face dozens of headwinds that constantly disrupt the one thing your organization needs but rarely achieves: harmony in the orchestration of patient progression and care for every patient, every day. This is where the creation of an operational command center becomes essential for your hospital. According to the global research and advisory company Gartner, as the center of the real-time health system platform model, the command center uses real-time operational intelligence to anticipate, optimize, and orchestrate healthcare provider enterprise and network resources, workflows, and capacity in response to changing internal and external conditions. Hospitals may have pieces of this in place, like bed management, transfer centers, or incident command. But what does it mean to have a true operational command center? And how will this help you achieve harmony in the orchestration of patient progression and care? Let's look at some key attributes of operational command centers and what they provide. Strong bidirectional communication that empowers frontline decision-making. Real-time, predictive, and actionable intelligence. The ability to better coordinate test, procedures, and even transfers. Ultimately, your essential hospital could sustain dramatic results in patient throughput, quality, and experience for your entire patient population. You may be wondering, what are some specific benefits that a command center can bring to your essential hospital? A key benefit of an operational command center is enhanced care coordination that can start as early as the emergency department. Patients' needs based on social determinants of health at the time of admission are identified, and a plan is put into place that allows you to orchestrate a smooth experience through their stay. Your mission is to make sure that all patients receive the care they need. This dedicated model ensures the most at-risk, like homeless or unfunded patients, get additional coordination that will support their wellness. If you find your hospital is often strapped for capacity, an admission gatekeeper role in the emergency department can help ensure only appropriate patients are admitted, the ones that really need the bed. The gatekeeper role ensures those not admitted have what they need in the outpatient setting. This role is an extension of your operational command center that uses bidirectional communication to ensure your capacity is utilized by those that need it most. Another important benefit of an operational command center in your essential hospital is the ability to optimize existing systems and staffing to increase capacity for diagnostic and procedural services. You likely have inpatients that have many comorbidities, such as diabetes, emphysema, and HIV, that are unmanaged. These patients will often need more diagnostic tests to determine how to best progress each of them toward a safe and timely discharge and long-term wellness. Amidst the complexity and competing priorities of trauma patients, it's often a struggle to get tests and procedures completed timely for all patients. A higher level of prioritization and orchestration is necessary. Without alignment across service lines, physician groups, and care teams, patients could suffer. Your operational command center must have resources and tools dedicated to solving these service coordination challenges. Other vital tools in your command center will provide real-time actionable intelligence that help you identify and proactively address the status of capacity and patient progression. Think about when patient progression barriers are typically identified at your hospital. If they're identified the day before or the day of discharge, this may be too late to meet your length of stay goals. As part of a successful operational command center, applications provide visibility to possible barriers to discharge. Many patients may lack support systems and access to medication outside the hospital. As your care team becomes aware of issues that are standing in the way of the patient's progression, they can proactively address them. Real-time, actionable intelligence means that potential barriers are visible early, and the care team has more time to get them resolved, which prevents delays. For example, at 7 a.m., an automated report could be generated to leadership that shows the progression or discharge barriers of the hospital's homeless population. This enables the appropriate leaders to intervene to resolve existing barriers. Prompted by data, they can work with the care team on the unit to support them in planning the next steps for each patient with an identified barrier. Let's recap the critical key benefits. Enhanced care coordination that can start as early as the emergency department. Increased capacity for diagnostic and procedural services. Real-time, actionable intelligence to address the status of capacity and patient progression. So what kind of results can be expected when you orchestrate care through an operational command center? The unique components of a care logistics operational command center deliver many improvements across different measures, but most notably, a 14.2% increase in outpatient diagnostics, an overall barrier resolution time reduction of 22.8%, and a reduction in length of stay of 0.52 days. These results equate to greater than 11,000 fewer excess patient days, or the creation of 31 virtual beds. In addition, hospitals in this study achieved an average financial improvement of $19.1 million. So what happens without this enhanced command center model? You miss out on the opportunity to put over $19 million back into the care of your most vulnerable patients. If you're not satisfied with your organization's performance in any of the areas that you've seen in this video, it could be time to take action. Contact us to find out how to start your journey of orchestrating harmony in the progression of care with Care Logistics.